Welcome to Phase 1 of the Million Death Study Physician Training Program. Thank you for contributing to our study dedicated to transforming health in India. For any questions or concerns about this training, contact us at mdslearn@smh.ca. For details and publications regarding the Million Death Study, please refer to our website at www.cghr.org/mds. Follow CGHR on Twitter at CGHR_org. Let's take a minute before we begin to review how to navigate this program. Let's take a minute before we begin to review how to navigate this program. The Table of Contents tab on the top left of the screen displays the structure of the course. You can navigate through the program by clicking on each heading. Beside the Table of Contents tab is the Transcript tab. Here you will find the written transcript of the audio component of the course. On the far right top corner of the screen is a tab for Attachments. This provides a list of all the external attachments that are required reading. Note that you may need to download Adobe Acrobat to view these files. The button on the bottom left of your screen is the volume control. In the middle are the play or pause, back and next buttons. The play button plays the course. The pause button stops it without closing the whole platform. The back button takes you back a screen on the next button moves you forward. Clicking on the button on the bottom right of the screen will hide the table of contents and make the presentation larger. To return to the table of contents, simply click the button again. Now we are ready to begin. Click on the next button to proceed. This training program is designed to teach you to assign cause of death codes to verbal autopsy forms. Phase 1 consists of this instructional video which contains lessons, a tutorial, an interactive quiz and worksheets that will assist you to become an MDS coder. This training package also includes the latest version of the MDS training manual and instructions on how to use the coding software you will be required to use to take the Phase 1 coding exam. If the exam is successfully completed, you become eligible for Phase 2 training. Phase 1 is designed for self-instruction. Phase 1 is designed for self-instruction and should be used at your own pace within the timeline allowed. The content is intended to be used in conjunction with the extra information provided in the attachments and in the package. Please read each item carefully. You have 30 days to complete both the training and the coding exam. No extensions will be granted. Completing on time is one of the key determinants of your selection as a coder. For your efforts, we will provide you an honorarium of 250 rupees to complete the first phase and 2500 rupees to complete the second phase. Your job as coder will be to review verbal autopsy records and assign them a cause of death or COD code. These records come from a method called RIME or Routine Representative, resampled household investigation of mortality with medical evaluation. RIME involves a household assessment of the train of events and circumstances throughout the course of illness leading to an individual's death. This is achieved through an interview of those close to the deceased conducted by non-medical field staff. The staff is trained to probe for cause of death information by asking a series of structured questions about the major or cardinal symptoms present during the time of illness. We will address cardinal symptoms further shortly. 4 different RIME field forms are used to collect detailed information on neonatal, child, adult and maternal deaths. This information then gets reviewed by physician coders like you, who determine the most appropriate cause of death. A sample RIME form is included in the attachments for your reference. You will be using the International Statistical Classification of Diseases and Health-Related Problems or ICD to code these RIME records. This is the system used by the World Health Organization to classify diseases and other health-related problems. Currently, we are using the 10th version of ICD, which is why we often refer to it as ICD-10. The basic ICD is a coded list of 3-character alphanumeric categories with a letter in the first position, followed by a number in the second and third positions. The ICD classification has grouped these codes into a total of 22 chapters organized by disease, disorder, or event. Here is a list of the ICD chapters and their corresponding codes. It is important to note that 3 of the ICD chapters, 19, 21 and 22, are not used routinely for coding the underlying cause of death. The other 19 chapters are listed here. Infectious diseases, for example, tuberculosis, A15 to A19, HIV, B20 to B24, and measles, B5, are listed in Chapter 1, consisting of A and B codes. Cancers are listed in Chapter 2, consisting of C and D codes. Obstetric conditions are listed in Chapter 15, consisting of O codes. Perinatal conditions are listed in Chapter 16, consisting of P codes. Congenital abnormalities are listed in Chapter 17, consisting of Q codes. Injuries, intentional, unintentional, and of unknown intent, are listed in Chapter 20, consisting of V, W, X, and Y codes. Symptoms and ill-defined causes are listed in Chapter 18, consisting of R codes. Other diseases are categorized according to organ systems from Chapters 3 to 14. For example, the code for acute myocardial infarction is I21. The code for epilepsy is G40. The code for asthma is J45. The codes for renal failure are N17 to N19 and so on. Note that while tuberculosis is listed in Chapter 1 with an A code, pneumonias are listed in the Chapter 10 with J codes. Please familiarize yourself with the chapters and corresponding codes. A more complete listing of codes can be found in the MDS manual in the attachments. The cardinal symptoms list is a set of standard disease descriptions and criteria for some of the common causes of deaths in India. In order to maintain data uniformity, the field staff conducting the verbal autopsies has been trained to try to account for these symptoms in the interview through probative questions. If the respondent has trouble providing information about the condition or illness, the field worker will go through each cardinal symptom one by one in an effort to get as much information as possible. For example, he will ask, "Did the deceased have chest pain? Can you describe it?" There are 3 lists that cover adult, child and neonate symptoms. You may not continue until you have reviewed all 3 lists. As a familiarity, you may not continue until you have reviewed all 3 lists. As a familiarity with their contents is vital to the coding process. Please click on the bars to review each adult symptom. When you are finished, click on the next button to advance to child symptoms. Please click on the bars to review each child symptom. Please click on the bars to review each child symptom. When you are finished, click on the next button to advance to neonate symptoms. Please click on the Please click on the bars to review each neonate symptom. When you are finished, click on the next button to continue. Tutorial: Cause of death definitions, guidelines and examples. Tutorial: Cause of death definitions, guidelines and examples. Since the ability to determine cause of death is at the heart of this training, we will first take you through a COD tutorial before we introduce you to the 6 steps we think are vital to the coding process. This tutorial is separated into 3 parts. Part 1 defines underlying cause of death. Part 2 addresses risk factors for death. Part 3 offers examples and a quiz to help you determine the correct underlying cause of death. Part 1 Cause of Death Part 1 Cause of Death Definitions and Concepts. Frequently, there are multiple conditions that cause death. In MDS, we allow for only one cause per death, the underlying cause. The World Health Organization defines underlying cause of death as the disease which initiated the train of events leading directly to death, or in case of an injury death, the circumstances of the accident or violence which produced the fatal injury. To be clear, the underlying cause of death is not the terminal event that occurred just before death. This is the mode of death. Modes of death such as respiratory failure, cardiac arrest or brain death should not be considered as underlying causes. As well, apart from the situations where a clear sequence of events exists, there are frequent instances, notably among adults, where other significant medical conditions exist. These instances do not fit into the sequence, but still may contribute in an indirect manner to the final event of death. In such situations, those diseases or conditions that are independent of the causal chain of events are often called contributory causes of death or comorbidity. For example, if a person dies of a stroke but had diabetes in the past, then diabetes may have contributed also to this condition. Similarly, if a neonate dies of diarrhea and also has low birth weight, then low birth weight may be a contributory cause of death. It is often a judgment call on what is the underlying and what is the contributory cause of death. Again, use your best clinical diagnostic skills and include relevant information as keywords when coding. We will discuss how to note keywords in a moment. As you are working through the record, it will help you to order the events in chronological sequence. We'll show you an example in a minute. This will assist you to arrive at the single most important disease, disorder or event that led to death. As you do, it will be clear that many underlying causes of deaths are straightforward, such as tuberculosis, tetanus or road accidents. But in some cases, the underlying cause of death is not so easy to determine. For example, a diabetic suffers kidney failure, has a heart attack and dies. Which is the underlying cause? To help you, remember that conditions such as risk factors, comorbidity or contributory causes of deaths should certainly be considered. But in the end, you must use your best clinical judgment to select the single most important disease, disorder or event that led to death. We will address the causal chain of events in more detail in Phase 2. You must note that it is possible for two physicians to review the same record and come up with different yet totally plausible diagnoses. We will provide examples of such ambiguous narratives in the worksheets featured later in this training. Always return to your best judgment and remember, you must choose only one cause of death. Part 2. Risk factors versus underlying causes of death. You may encounter cases that have several risk factors for death, such as a diabetic dying from renal failure or a smoker dying from lung. Part 2. Risk factors versus underlying causes of death. You may encounter cases that have several risk factors for death, such as a diabetic dying from renal failure or a smoker dying from lung cancer. As much as possible, you should try to code the underlying cause of death and not the risk factor, even if the risk factor is very important. However, in some cases, you will have no choice but to use a risk factor as an underlying cause of death. Sometimes, it is the only possible answer. Do not allow yourself to become biased by any clinical diagnosis mentioned in the form. Take them into consideration, but use your best judgment to determine the most appropriate underlying cause of death. You should always note risk factors as keywords when coding the record. Here are some common examples of risk factors versus underlying causes of death. Keep in mind that in some cases, you will have no choice but to use these or other risk factors as underlying causes of death. Malnutrition, low birth weight, and diarrhea of death. Malnutrition, low birth weight, and diarrheal or measles death. Generally, code the infectious cause of death such as diarrhea or pneumonia or measles which resulted in death. Note malnutrition, low birth weight as your keywords. For smoking, drinking and cancers, you will not be given smoking, alcohol or diet history. But the narrative might still reveal such behavioral risk factors. Code the relevant underlying disease and rely only somewhat on the fact that the person smoked. That is, not everyone who smokes gets cancer, and not all those who have cancer smoke. Your keywords should include smoking, drinking, and or other risk factors. For diabetes and renal failure, generally code renal failure even if it was diabetes that led to the series of events that resulted in renal death. However, you will see later that there are exceptions to this rule. Your keywords should include diabetes, but your cause of death should be renal failure. Hypertension and hypertensive heart disease should not be coded as a cause of death. Instead, code the conditions to which hypertensive heart disease leads, such as congestive heart failure, myocardial infarction, or stroke. Note hypertension as the keyword. A note of caution. Here is where you have to unlearn what you learned in medical college. In a hospital, you have clinical and other information available for most of the cases you see. But these detailed clinical data and tests are almost never available in the household interview. Therefore, you have to rely on the relevant symptoms and use your judgment as to the most likely cause of death based only on the information provided. As well, you should think of common diagnosis rather than rare, exotic diagnosis for any given narrative. And finally, even while attempting a very specific diagnosis, it's important to remember that a major category diagnosis is as important as a more specific one from a public health viewpoint. For example, in children, it's as important to note LRI as it is to indicate whether it's a bronchiolitis or a viral or bacterial pneumonia. The following are 3 examples of how to determine the underlying cause of death. Read the narratives carefully and follow along with a chronological sequence of recorded events. Take note of the keywords. Example 1. An 80-year-old female slipped and fell on the bathroom floor at home and broke her hip. She became bedridden, developed pneumonia and died. Note the chronological sequence of events. The fall came first, resulting in a hip fracture, causing immobility and leading to the terminal event, pneumonia. The underlying cause of death, however, is falling. Based on the narrative, we are even able to determine that it is a specific kind of fall on the same level from slipping, tripping or stumbling or ICD-10 code W1. Important keywords you should note are fall, fracture, bedridden and pneumonia. Example 2. A 55-year-old male patient had a past history of stroke 1 year back and was found to have high BP. In addition, he had several episodes of angina. He presented with sudden onset heart failure, did not respond to diuretics and died in his sleep. Note the chronological sequence. Based on the cardinal symptoms you reviewed earlier, we know that the stroke cannot be considered the underlying cause of death because death did not occur within a month of the stroke. Here the underlying cause of death is coronary heart disease manifesting as angina or specific ICD-10 code I-25. This is the disease that initiated the train of events leading to death, in this case, congestive heart failure. Here, hypertension is both a risk factor and a contributory cause of death. so should not be considered as underlying, even though it happened before the angina. The keywords are BP, angina, sudden heart failure, and diuretics. Example 3. A 48-year-old male drank alcohol regularly for 30 years. Over the past year, he developed jaundice, abdominal fullness, and tremor of hands. A few months back, he passed black-colored stools. The doctor diagnosed damaged liver and advised medicines and abstinence. But he didn't stop drinking. Suddenly, one day he vomited a lot of blood and was rushed to the hospital. In spite of treatment, he died. The underlying cause of death here is alcoholic liver disease, or ICD-10, code K70. Though it was his drinking that made him sick, alcoholism is a risk factor and therefore cannot be considered a cause of death. Also, not everyone who is an alcoholic dies from liver disease. Keywords to consider are alcohol, jaundice, damaged liver, and vomited blood. The following 5-question quiz has been designed to determine if you understand how to identify the underlying cause of death. Be sure to put the events in correct chronological sequence in order to reveal which disease or event initiated the chain of events leading to death. Please take your time and answer the questions thoughtfully. Ensure that you have at least a passing grade before you continue with the program. Question 1. When Rukmini had prolonged labor pains during the 9th month, she was taken to the hospital for delivery. She had a difficult delivery and gave birth to a 2.1 kg baby boy. The newborn did not cry well at birth. Subsequently, he developed seizures and was admitted to the special newborn care unit. In spite of the treatment, the baby died on day 3. The correct underlying cause of death is A. Low birth weight, B. Birth asphyxia, C. Hypoxic ischemic encephalopathy. Keywords that you might include are LBW, term delivery, poor cry, and seizures. Question 2. Naveen was born with a birth weight of 2.6 kg. In the first year of life, he was severely malnourished. When he was 15 months old, he had severe diarrhea resulting in dehydration. Soon after, his urine output decreased and the local doctor diagnosed acute renal failure. He died on the way to the hospital. The correct underlying cause of death is A. Acute renal failure, B. Acute gastroenteritis, C. Dehydration, D. Malnutrition. Keywords that you might consider are normal birth weight, malnourished, diarrhea, dehydration, and renal failure. Question 3. For the past 10 years, 60-year-old Vikram suffered from hypertension. A month before he died, he developed paralysis of the left side of his body and was subsequently bedridden. He died within 2 days of developing bed sores and a fever. The correct underlying cause of death is A. Septicemia, B. Hypertension, C. Decubitus ulcer, D. Stroke or cerebrovascular accident. Your keywords might include hypertension, paralysis on the left side, bedridden, bed sores, and fever. Question 4. 42-year-old Bahadur was brought to the hospital emergency department with an infected wound on his right foot. Because of repeated convulsions, he was admitted to the hospital. He could not open his mouth, could not swallow anything, and there was stiffness in his neck and body. He was also sweating a lot. His wife reported that while working in the fields 10 days back, he had stepped on a nail. He treated the injury by himself. The patient died of repeated convulsions on the second day after admission in the hospital. The correct underlying cause of death is A. Stepping on a nail, B. Convulsions, C. Tetanus, D. Infection. Keywords that you might include are nail-penetrating skin of foot, infected wound, convulsions, difficulty opening mouth, stiffness of neck and body. "23-year-old Radhika, who had delivered 5 previous children, was brought to the Taluk hospital in the 9th month of her current pregnancy. She had been complaining for 6 hours of cramping pain in her abdomen and also bleeding from the vagina with passage of large clots. In the hospital, she continued to bleed from her vagina as well as the site on the arm where blood was collected for testing. Then she suddenly collapsed. No fetal heart sounds were heard. Despite administration of blood, both mother and baby died 1 hour after admission. The correct underlying cause of death is A. Disseminated intravascular coagulation, B. Hemorrhage, C. Abruptio placenta. Keywords to consider are 6th child, 9th month of pregnancy, cramping, bleeding from vagina and needle site, blood clots and abdomen pain. Here is a Here is a recap of what you should have learned in this tutorial. If you feel you have missed anything, we encourage you to review the information from the beginning. Always lay out a chronological sequence to look for the underlying cause of death, meaning what was the determinant that initiated the train of events leading directly to death. Remember that in NDS coding, it's always one underlying cause per death. You should always ask yourself what event was the key that led to the final sequence of events that ended in death. Generally, do not code the following risk factors, but always add them as keywords. For adults, the risk factors are diabetes, hypertension, smoking, and alcohol. For neonates, the risk factor is low birth weight. For children, the risk factor is malnutrition. There are always exceptions. Use your best clinical judgment. If you have any further questions, please feel free to email us at mdslearn@smh.ca. Underlying cause of death is a crucial step in the coding process, and we want to make sure you have a thorough understanding before you proceed. Years of experience. Years of experience with the Million Death Study have shown us the most efficient, accurate, and reliable way to code causes of death is by following the 6-step process we will teach you in this program. The 6 steps are: 1. Carefully read the past medical history and the narrative included in the record. 2. Highlight cardinal symptoms and negative evidence. Note keywords. 3. Think of the chronological sequence of events. Adhere to the cardinal symptoms and any negative evidence. Do not imagine facts that are not in the record. 4. Choose the underlying cause of death. Select the most specific ICD code possible and confirm against the guidelines. 5. Reconsider your ICD code using differential diagnosis. 6. Select certainty of diagnosis and quality of narrative. With consistency and repetition comes mastery. It is imperative that you always repeat these 6 steps for each record. You will become a good and fast coder if you rely on your clinical judgment and always follow these same steps. In order to effectively illustrate these 6 steps, we will be applying them to a sample narrative. You should note that this narrative is an ideal example. It is comprehensive and reasonably well written. It follows a chronological sequence of events and it has a clear cause of death. Not all narratives you code will be this complete. But if you consistently apply the 6 steps to each record, you will end up with quality data each time. Please read the following example and click on the next button when you're ready to move on. Now, let us go through the steps one by one. Step 1 is to carefully read the past medical history and narrative. While there is no way to effectively illustrate it, this step is probably the most important. For most cases, you should be able to gather all the details you need from both the past medical history and the narrative to make an informed assessment of cause of death. In this example, a careful reading of the rhyme record has revealed relevant parts of the narrative that will be important as we go through the remaining steps. Step 2 tells you to highlight cardinal symptoms and negative evidence and note the keywords. You will recall that the cardinal symptoms list is a set of standard disease descriptions and criteria for some of the common causes of deaths in India. Your job as coder is to look for these carefully in the narrative and other information on the form. Note that negative evidence is the absence of a particular symptom, sign, or past history. It is also important and must be recorded. Noting keywords will be covered in the software demonstration at the end of your training. The act of highlighting important details is a technique that you will also learn in the demo. And it's important you have a mouse or cursor button in good working order. As we have mentioned, step 2 is critical because friends and relatives who may not have been able to recall minute details of the events leading to death would have been asked pointed questions about such symptoms. And while highlighting and noting words are actions specific to the software we are using, they are also common practice when making a clinical diagnosis in general. If the record actually includes any relevant diagnostic information, you should note this down as well. In our example, careful reading of the narrative reveals that the cardinal symptoms are aspiration bronchopneumonia, mentioned as got pneumonia while passed out, prolonged coma or behosh, and stroke indicated by the phrase paralysis on one side of the body. The keywords include attack on one side, tongue twisted, blood pressure, and behosh. Step 3 requires that you think of the chronological sequence of events from the narrative. This is not something to be done within the coding software, but as a helpful part of your thinking process as you arrive at an underlying cause of death. Adhere to the cardinal symptoms and negative evidence provided, and do not imagine facts that are not in the record. It's crucial that you use your best clinical judgment but not to make assumptions or jump to conclusions. Remaining as objective as possible and sticking to the information provided in the record will allow you to have standardized codes and produce quality data. In our behosh example, by constructing a chronological sequence of events, you will see that the stroke or CVA or ICD-10 code I-64 initiated the chain of events that resulted in the pneumonia and death, and hence the stroke is selected as the underlying cause of death. Step 4 is a three-part process. The first part Step 4 is a three-part process. The first part requires you to use your best clinical diagnostic knowledge and skills to identify the underlying cause leading directly to death in the record. The second part starts once you have chosen your code. Enter it into the description text box on the main page of the coding software, which you will see after step 6, and press enter. This will automatically produce a drop-down menu of specific ICD codes relevant to your diagnosis. You are encouraged to attempt assigning wherever possible the most specific disease or condition causes and codes rather than ill-defined conditions. For example, ICD code C34, malignant neoplasm of bronchus and lung, is a more specific code than C39, malignant neoplasm of ill-defined RS or intrathoracic sites. B50 or falciparum malaria is more specific than B54, unspecified malaria. Where you have exhausted every possibility of a specific cause and are still undecided, enter R99 for an adult record. Malaria is more specific or intrathoracic sites. B50 or falciparum malaria is more specific than B54, unspecified malaria. Where you have exhausted every possibility of a specific cause and are still undecided, enter R99 for an adult record or P96 for neonates. However, this should be avoided if at all possible. Remember that relevant keywords should always be noted as well as any thoughts that contributed to your indecision. The third part is done once you have chosen your specific ICD code. When entered, the code will generate a list of relevant diagnostic guidelines against which you should compare your choice. Make sure the guidelines match up with the keywords and symptoms you noted in step 2. In our example, we chose stroke CVA or ICD-10 code I64 as the underlying cause of death. When we compare our choice to the relevant diagnostic guidelines provided by the coding software, we see that you should compare your choice. Make sure the guidelines match up with the keywords and symptoms you noted in step 2. In our example, we chose stroke CVA or ICD-10 code I64 as the underlying cause of death. When we compare our choice to the relevant diagnostic guidelines provided by the coding software, we see that our keywords match up with sudden onset of paralysis of one or more limbs in the month preceding death and unconsciousness. Step 5 reminds you to reconsider differential diagnosis. This step is not intended to make you second-guess your ICD choice. Rather, it is only intended to remind you of other possibilities you may not have thought of. You will see in the software demonstration that these differential diagnoses conveniently appear when the ICD guidelines appear. Use your best judgment to retain your code. Change it to one of the other choices provided, or dismiss both options and start again. Remember to assign the most specific ICD-10 code applicable for the cause of death you are coding. Should you need to assign a code not in the short list of common ICD-10 codes provided in your MDS manual, or require a more specific code, you can always do a Google search on the internet. In our example, the differential diagnosis for stroke would be ischemic heart disease I20 to I25, falls W0 to W19. However, no history of chest discomfort possibly rules out ischemic heart disease, and no history of falls rules out the fall. The final step, step 6, is to grade your own certainty of diagnosis and your feelings on the quality of the narrative. This is necessary should others be required to review your work or re-diagnose your form. These are steps we will cover in phase 2. You should grade your certainty of diagnosis as high 1 or low 2. You also must rate the quality of narrative. This can be either good 1 or poor 2. As we mentioned earlier, our example is an ideal narrative. As such, the diagnosis is clear and certainty should be rated as high 1. The quality of the narrative is also very high and should be rated good 1. These 6 steps constitute the core of our training program. If you feel you have missed anything, we encourage you to examine the steps again from the beginning. We also strongly encourage you to supplement this training by reading the complete MDS manual sent to you and provided in your package. Commit to the 6-step process, you will now be required to review examples that walk you through the steps to code 3 more sample narratives. These narratives include information you would have access to should you have been able to see the whole rhyme form. After these examples, you are encouraged to complete 10 coding worksheets to make sure you understand the 6-step process. 3 more process, you will now be required to review examples that walk you through the steps to code 3 more sample narratives. These narratives include information you would have access to should you have been able to see the whole rhyme form. After these examples, you are encouraged to complete 10 coding worksheets to make sure you understand the 6-step process. At the end of these examples and the worksheets, you should feel ready to take the coding exam. Please read each example and click on the bars to work through their corresponding steps. When you are finished, click on the next button to proceed to the next example. Example 1. Since we can't illustrate a careful reading of the narrative, we will begin analyzing the example on step 2. Step 2. Keywords: vomiting, not growing properly, thin, small at birth, term pregnancy. Step 3. Vomiting for every feed, regurgitation, poor feeding. Due to term pregnancy. Third baby, pale, weak, thin LBW, not growing properly. Step 4. History suggests regurgitation rather than some form of projectile vomiting. Child was third female child and all accounts suggest that she was small for gestational age or low birth weight. ICD code P5. This was likely the COD. Note full-term pregnancy as an important negative, thereby ruling out prematurity as a cause. As we discussed earlier, this is an instance where for neonates a risk factor such as LBW is acceptable as a cause of death. Keywords match the guidelines. Full-term pregnancy, smaller than average size baby. If weight, birth weight below 2.5 kilograms and no other obvious causes of death, possibly with poor suckling after birth or death at 3 to 7 days. Step 5. Consider differential diagnosis. Prematurity P7 or birth asphyxia P21. The keywords term pregnancy rule out P7 while able to cry or breathe at birth rules out P21. Step 6. In this case, the certainty of diagnosis should probably be a low or 2 as the baby died on 20th day after birth. Quality of narrative is good 1. Assuming a careful read of the narrative, here are the steps for example 2. Step 2. Keywords: convulsions and unconsciousness, high fever with chills, eyes become yellowish, weakness, low birth weight, and repeated illness in past 6 months. Step 3. Convulsion and unconsciousness. Due to fever, chills, yellow eyes, infection, due to small at birth, repeated illness, malnourishment. Step 4. COD likely malaria B50. Keywords match guidelines. Acute onset of high-grade fever with chills and rigor. Fever may be intermittent and any one of the following: jaundice, convulsions, unconsciousness, breathlessness, decreased urine output, headache, and none of the following. ARI, meningitis, burning during urination, rash on body, heat stroke, or blood test positive for malaria. Step 5. Consider differential diagnosis. Meningitis, encephalitis, G0 to G9, A81 to A89, typhoid A1, dengue A90 to A91, acute pneumonias J18 to J22, acute hepatitis B15 to B19. No history of neck stiffness, fluctuating level of consciousness may rule out G0 to G9 and A81 to A89. No history of coated tongue, stepladder fever rise may rule out A1. No history of vomiting, prominent aches in muscles, bones, forehead, behind eyeballs, any history of bleeding may rule out A90 to A91. No history of cough rules out J18 to J22. High fever rules out B15 to B19, and some jaundice is possible in malaria. Step 6. Certainty of diagnosis is high 1. Quality of narrative is good 1. Note that LBW and inadequate breastfeeding are contributory conditions. Assuming a careful read of the narrative, here are the steps for example 3. Step 2. Keywords: old age, BP problems, sciatica, headache, blurring vision, and assuming a careful read of the narrative, here are Step 2. Keywords: old age, BP problems, sciatica, headache, blurring vision and giddiness, fell down and smoker. Step 3. Headache and blurring of vision, giddiness and fell down due to hypertension caused by smoking, sciatica and old age. Step 4. COD likely stroke, CVA, ICD, I64. Keywords match guidelines. Sudden onset of paralysis of one or more limbs in the month preceding death and any one of the following: unconsciousness, loss of vision, urinary incontinence, loss of sensations on any part of body, altered speech, sudden onset of headache with altered sensorium, late onset of convulsions and no previous episodes of convulsion. Note: do not use hemiplegia G81 to code for stroke. Step 5. Consider differential diagnosis: epilepsy G40 to G41, meningitis, encephalitis G0 to G9, A81 to A89, malaria B50 to B54, ischemic heart disease I20 to I25, falls W0 to W19. No history of convulsions of body parts over several months or years with fit on the day of death rules out G40 to G41. No history of fever and neck stiffness with fluctuating levels of consciousness may rule out G0 to G9 and A81 to A89. No history of fever rules out B50 to B54. No history of chest pain, discomfort may rule out I20 to I25. Non-hypertensive, suddenly developing blurred vision and giddiness may suggest stroke rather than simple fall. Step 6. Certainty of diagnosis. High 1. Quality of narrative good 1. To practice the process, you must now complete these 10 worksheets on the 6 steps. Please download the exercises from the attachment section, which you must print off to complete. The answer key is at the end. Try not to look at the answers until you have finished all 10. You may not continue until you have reviewed the worksheets. Some final to practice some final words of caution. Don't force yourself to arrive at a diagnosis if there is insufficient information. Don't try to make a pathological diagnosis, that is, trying to specify a particular type of myocardial infarction. It is very difficult from the RIME report to do so. Moreover, while such pathological diagnosis is appropriate for clinical and hospital care, getting right the overall categories of causes of death is far more important for public health. Don't be biased by the respondent's education level or other characteristics. Misconceptions abound across education or income levels of respondents. The narrative plus history is the basis for assigning the cause of death. Don't rely on the risk factors alone for making a diagnosis. For example, cirrhosis occurs not only among alcohol drinkers but also among non-drinkers. Similarly, lung cancer can happen among smokers and non-smokers. Congratulations! You have now completed the first phase of training. In order to test your comprehension and retention of this program, you will now be required to pass the coding exam, where you must code 50 records to the best of your ability. Your work will be graded on whether you followed all the critical 6 steps and what you choose as your final ICD assessment for each record. Before you begin your exam, please review the instructions for how to use the coding software. If you have any questions regarding the content of this program that you feel cannot be answered by reviewing the material, please contact us at mdslearn@smh.ca before you begin the exam. Good luck!